Ayan. Good morning, everyone. Okay.
Morning po.
Okay,
Good
let's start.
morning po.
So before we start, I would like to congratulate most of you. I think everyone, 'di ba? Pasado naman ata sa prelim, right? I hope you're able to see your prelim grade. Nag-send na ako sa email nyo. So yung mga hindi pa nakakita ng prelim grade, please check your email kasi nandun na siya. And then halos lahat naman nakapasa. Tapos matataas pa yung mga grades nyo, right? Maraming naka 1.75, 1.5. Okay, so congratulations to all of you. Sana pagdating ng midterm and finals, ituloy-tuloy niyo yan, ha? So now let's talk about the medical technology education in the Philippines. This is the topic for this week. So what is a curriculum? So maraming definitions and description kung ano ba ang curriculum. But in simpler words, sa simpleng explanation lang, a curriculum is actually a document that serves as the technical guide, okay, on learning for the students. Ito yung technical guide na ginagamit ng mga professors nyo, ng mga teachers nyo to give you the necessary information that is needed for your studies. Okay? So, ano ba ang purpose ng curriculum? Saan ba nagagaling kasi ang curriculum? So, I'm going to talk about the setting here in the Philippines, ha? So, in the Philippines, we have CHED, 'di ba? Which is the Commission on Higher Education. So, ang CHED, that is a regulatory body in the Philippine government that actually serves to make sure that all of the universities and colleges are adhering to the Philippine standards or they are following the Philippine standards. So, sila yung nag-set class ng mga standard. Meron sila mga guidelines na binibigay kung ano ba yung mga dapat gawin ng isang university or college. Okay? So, nandoon yung kanilang listahan ng mga gamit. So, dapat ang isang college daw, merong mga ganitong gamit. Hindi lang gamit class ang pinag-uusapan dyan, hindi lang classroom, hindi lang mga upuan, di ba? Kasama din dyan class ang mga learning materials. And then those learning materials are also standardized by CHED. So kung ano yung ginagawa sa isang university, ganun din ginagawa sa ibang university. So yung inaaral nyo dito sa Fatima, yun din ang inaaral sa ibang university. It's the same because everything is standardized. Okay? And then that is the purpose of the curriculum. Ang curriculum, that is the document na nakalagay dyan kung ano yung mga aaralin nyo. Ano yung mga courses or the subjects and then what are the topics for each subject or courses. Okay? So that is why you have the curriculum. Standardized yan, class. So, based on the definition of a curriculum, so it is a knowledge and skills students are expected to learn. So nakalista yan doon sa curriculum nyo. Ano ba yung mga knowledge na dapat malaman nyo? When you say knowledge, ito yung mga theoretical part. For example, definition of terms, di ba? Kunyari, ano ba? Bacteria, 'di ba? That is a medical term. Anong kanyang definition? It is a microorganism that is able to cause infection. So, since nalaman mo na 'yon, that is your knowledge. Theoretical 'yun eh. Ano naman yung skills, 'di ba? Yung skills, kapag natuto ka na kung paano mag-process ng bacteria. So, natutunan mo na kung paano siya tignan, paano ka mag-identify ng bacteria, paano ka magpatubo ng bacteria, and paano ka mag-test ng antibiotics against bacteria. So that is under skills. Okay? So lahat yon nakalista yan sa curriculum yung mga activities na gagawin nyo para matutunan nyo yung knowledge and skills. Okay? So, which include the learning standards. Yan, sabi ko nga kanina, may mga standard yan, di ba, galing from CHED. Or learning objectives that they are expected to meet, the units and lessons that teachers teach, the assignments and projects given to students. So even your assessment, even your projects, they are standardized coming from CHED, okay? The books, the materials, even the reference materials, di ba? Yung mga books na pinapabili namin, lahat yan standardized from CHED. The videos, the presentations, the readings, the test, assessment, and other methods used to evaluate the student learning. Okay? So, paano ba ang sistema sa Pilipinas? So, under ng CHED, meron silang tinatawag na technical committee, which I'm going to discuss later. Okay? So, next, ano bang characteristic ng curriculum? It must be systematic and organized, just like what we have here in Fatima, di ba? For example, sa first year nyo, meron kasi mga reason kung bakit yung mga subject nyo sa first year, ito yung una nyong kinuha. So, Una-una nandiyan ang anatomy and physiology, 'di ba? Ang anaphysio dapat talaga 'yan yung pinaka-basic na una mong matutunan kasi sa anaphysio matututo ka ng medical terminology. Magkakaroon ka ng overview kung ano ba yung nangyayari sa katawan natin, okay? Which is very important na dapat talaga ma-master niyo yung anaphysio. Kasi kapag hindi kayo natuto sa anaphysio, pagdating niyo ng second year or third year, you will be lost. Kaya nga foundation yan, importante yung anaphysio class. So ngayon pa lang, you are being introduced, ano ba yung katawan natin, what is happening in the body. And then meron ka rin chemistry 1, di ba? Or yun nga, Chem 111, 'di ba? Which is the general chem. Bakit? Kasi sa general chem, introduction pa lang yan sa chemistry. Pagdating mo ng second sem, meron ka ng analytical chemistry, meron ng computation doon. Okay? And then pagdating mo ng second year, meron ka ng biochemistry, magkakaroon ka ng overview kung ano ba yung nangyayari sa katawan ng tao. And then pagdating mo ng third year, doon na, 'di ba? Meron ka ng clinical chemistry. So, chemistry in relation to health. Kung ano yung nangyayari inside the body of a person. So, lahat 'yon ng natutunan mo sa general chem, analytical chem, biochem, lahat 'yan, ko-combine mo 'yan kasi kailangan mo siyang matutunan para maintindihan mo yung clinical chemistry 1. Kasi yung mga 'yan, foundation courses 'yan. So, kung napapansin niyo, ladderized, 'di ba? Ladderized yung progress niyo. So, nagsimula kayo sa basic na introduction to chemistry or gen chem, paakyat ka ng analytical chemistry, and then paakyat ka rin ng biochemistry. Hanggang pagdating mo ng third year, nandun ka na sa taas, nasa clinical chemistry ka na. Okay? So, systematic and organized dapat ang curriculum. So, may mga reason kung bakit yan ang mga subject na kinukuha nyo. And then, pagdating nyo ng next semester, kukuha ka na ng MLSP2, di ba? Second sem mo, MLSP2. Ang MLSP2 naman, all about the different sections in the laboratory. Sa MLSP1, na-introduce kayo kung ano ba yung medtech, di ba? Nalaman nyo may mga section in the lab. Pero pagdating ng MLSP2, iisa-isahin nyo na yon per section in the laboratory. Okay? Pag-uusapan nyo na lahat yon. So, yun ang difference. Yun ang characteristic ng pagiging systematic and organized ng isang curriculum. So, a curriculum must also state the outcomes or the knowledge and skills. When you say outcomes, ito yung mga expected na makikita sa inyo na progress nyo as you go along. So for example, after MLSP1, pagkatapos natin ng MLSP1, you are expected to have basic knowledge when it comes to medical laboratory science or medical technology. Since this is only a lecture class, wala namang skills na expected sa inyo, 'di ba? Kasi lecture class lang naman 'to. So magkakaroon ka lang ng knowledge, alam mo kung ano yung medtech, alam mo kung ano yung mga nangyayari sa lab, meron kang idea. Okay? That is an expected outcome. Okay? And then also, it is consists of a planned process of measurement, assessment, and evaluation. So lahat ng curriculum, dapat meron ka rin dyan na assessment. Kaya nga naman, hindi nawawala ang mga exams, di ba? So kung napapansin nyo, sa klase natin, every after meeting, I'm giving an exam. Lagi ako meron pa quiz, di ba? And then meron din akong pa-activity minsan, okay? Kasi that is part of the curriculum and I have to give that to you. And then it must be designed specifically for the students. Now, again, sabi ko nga kanina, lahat it is being regulated by CHED. And then under yung CHED, sa loob mismo ng CHED, gumawa sila ng tinatawag na technical committee. Yung technical committee na yun, it is comprised of the different academicians na expert sa pagtuturo ng medtech plus mga expert medical technologists in the industry. So, ito yung committee, may mga tao dyan na nanggaling sila sa mga ospital, sila yung mga leading medtech sa ospital, kaya alam nila kung ano yung mga demand na kailangan sa ospital. So, yung mga inaaral nyo, lahat nanggaling sa kanila. Okay? Sila yung mga nagsabi na dapat sa prelim, aralin nyo ito. Pagdating ng midterm, aaralin nyo ito. Pagdating ng finals, ito aaralin nyo. Sila nagsabi noon. Bakit? Kasi sila yung expert. Sila yung mga nagtatrabaho sa ospital, alam nila kung ano yung mga skills and knowledge na dapat alam ng mga medical technologists. Okay? And then, yung mga academicians naman, yung mga matagal na nagtuturo na expert na sa field na yan, alam din nila on how to deliver that to the students. Okay? Kaya nga naman, Ito, sabihin ko na sa inyo, okay? Kasi yung mga second year namin dati, nagkaroon sila ng nagulat sila pagdating nila ng ano, pagdating nila ng nag-take sila kasi ng bacteriology. Meron kasing subject sa second year na bacteriology. So nagulat sila, ang dami-daming tinuturo sa bacteriology. Ang sabi pa nga nila, "Ayoko diyan kay ma'am, ang dami niyang tinuturo. Bakit ba ang dami niyang tinuturo?" 'Di ba? Gano'n. So, na para bang kasalanan pa namin na marami kaming tinuturo. By the way, hindi namin 'yan kasalanan. Wala kaming bad intention sa maraming tinuturo. Lahat 'yan nanggaling 'yan sa CHED Technical Committee, okay? Sila yung nag-set ng standard na ito sa bacteriology dapat ituro mo ito lahat. Bakit? Kasi ang CHED Technical Committee ipapasa niya 'yan sa PRC. Si PRC naman siya ang gagawa ng board exam, 'di ba? Saan kukuha ng mga tanong? Si PRC. Kay technical committee siya kukuha ng tanong. Okay? Kaya nga naman, lahat ng mga topic na binigay ng technical committee, kailangan ko talagang ituro. Kasi kapag meron akong hindi tinuro do'n, yung estudyante hindi siya makakasagot sa board exam. Okay? So bakit marami? Bakit maraming tinuturo yung mga prof? Kasi nga maraming pinapaturo. Bakit marami? Because this is a medical course. Okay? Medical course siya. So, pagdating niyo ng higher level, pagdating niyo ng second year, pagdating niyo ng third year, I hope sana wag niyo pag-isipan na yung mga prof niyo pinapahirapan kayo. Hindi namin kayo pinapahirapan. Sadyang marami lang talagang topic at kailangan kong ituro 'yon kasi nga 'pag hindi ko 'yon tinuro, hindi ka makakasagot sa board exam. Okay? At alam mo naman natin na ang pinaka-goal natin lahat ay maging licensed professional. Kailangan makapasa kayo sa board exam. Kasi kung hindi kayo makakapasa, lugi ang parents nyo. Kawawa ang mga magulang nyo. Tandaan nyo, your parents are investing in your future. They are actually spending money to make sure that you will pass the board exam. 'Di ba? So, kung hindi ko ituturo yung mga yan, kung magiging tamad ako, 'di ba? Madali lang naman maging tamad, right? Na hindi ako magtuturo niyan, tinatamad ako, ang dami niyan, nakakapagod magsalita. Bahala na kayo, kayo na lang magbasa niyan. Hindi gano'n, 'di ba? Hindi kasi ako gano'n, class. Ako talaga, I really teach, tinuturo ko talaga 'yan. Kasi nga naman, lugi ang parents niyo kapag hindi nagturo ang mga prof. Okay, so ngayon pa lang first year kayo, I want you to have this mindset na medical course ang kinuha ko. And then marami talaga akong kailangang aralin kasi nga medical course. Okay, 'yon siya. Now, under ng curriculum din, nagkaroon ng definition kung ano ba ang BS Medical Technology or BS Medical Laboratory Science course. So, this is a 4-year course comprising of the first 3 years full of academics. So, yung first year, second year, third year nyo, puro lang yan academics. Nasa school lang kayo, nag-aaral kayo. And then, pagdating nyo ng fourth year, that is a 1-year internship program. Okay, wherein you will go to a hospital and render 1 year of duty. So in all FU, ang ginagawa namin diyan, dalawang rotation. Yung first rotation nyo, government hospital, and then yung second rotation nyo, yung first rotation nyo, that is comprising of 6 months. So yung fourth year first sem, that is your first rotation. 6 months yun, di ba? So usually, dinadala namin kayo sa government hospital. And then, after no 6 months na yon, pagdating ng second sem, fourth year second sem, another 6 months naman sa private hospital. So isang taon siya ang required talaga na mag-duty ka sa ospital. Now, sometimes, kapag walang available na private hospital, isang taon ka sa government hospital. Hospital 1 tsaka Hospital 2, which is actually very good kasi nga, actually kami sa Pampanga mas marami kaming affiliate na government hospital, mga regional hospital. Kasi nga sa government hospital, mas marami kang matututunan, mas maraming pasyente, mas maraming skills, 'di ba? Mas maraming chance na makapag-practice, which is actually very good. Now, in our yung curriculum natin, ang tawag sa curriculum natin is CMO number 13 series of 2017. So, pwede niyong i-search ito sa internet, makikita niyo kung ano ba yung laman ng ating METEC curriculum. Okay? Now, again, ano ba ang mga required based on our curriculum, yung mga required number of hours. So, if you have a 3 units lecture, you are required to attend 3 hours of class, a total of 54 hours per semester. Sa isang buong semester, that is divided into 18 weeks per semester. So, napapansin nyo, di ba, 18 weeks yan, right? Sa prelim, ilang linggo ba ang prelim? Meron kang 6 weeks sa prelim, di ba? Meron kang week 1, week 2, week 3, week 4, week 5, week 6, di ba? Ganon din class sa midterm, 6 na weeks din yan. Ganon din sa finals, 6 na weeks din. So, ang total of 18 weeks per semester. Tapos, yung number of hours mo, kapag 3 units lecture ka, 3 hours yan per meeting. So, sa buong semester, a total of 54 hours. Kasi 18 times 3, 54, okay? Yun siya. So, that is 3 units lecture. Now, paano kapag 1 unit lecture lang? Kapag 1 unit lecture lang, 1 hour lang ang required na hours sa klase per meeting. Okay? Kapag 2 units lecture, 2 hours ang required classes per meeting. So, how about sa laboratory? For the laboratory, if you have every 1 unit of laboratory, you are required to render 3 hours of class. Okay? So, kung 2 units laboratory yan, 6 hours of class. Nakuha? So, ganun siya. Every 1 unit of lab, 3 hours of class. Every 3 units of lecture, 3 hours of class. Okay? Ito yung mga required number of hours sa ating curriculum. Now, for the Gen Ed courses, ano naman yung mga Gen Ed courses? So, these are the courses that are mandated from the government that is needed for basic life skills ng mga tao. So, this is aimed for the holistic development of the student. So, for example, ito daw yung mga kailangan nyo na matutunan para mamuhay ng maayos. For example, ang math, di ba? Mathematics talaga kailangan niya sa everyday life natin. Purposive communication, this will help you communicate well. Ang Rizal na yan, ito yung subject na or course na kailangan nyo to instill nationalism. Okay? STS, basic yan about sciences, art appreciation about the arts, and ethics about moral values. Now, for the UNDAS, RIPH, and Contemporary World, this will enhance your reading comprehension. Okay? So, yun ang mga purpose of the Gen Ed courses. This is aimed for the holistic development of the student. Okay? Now, for the, ayan, so ito yung mga Gen Ed courses natin. And then these are the number of units. So for the Gen Ed, you have 24 units for the Gen Ed. 3 units na lang lahat class. And then, you also have the elective. For the elective courses, ito yung depende sa school kung ano yung bibigyan nila ng elective. So, in our university, we have the Veritas. Veritas 1, 2, and 3. Okay? So, dapat daw 9 units ang elective. Now, for the general education mandated course, that is the Rizal, which is 3 units. And then for the PE, we still have PE 1, 2, 3, 4, which is 8 units. So, nagtataka kayo, sabi noon dati ng mga estudyante, bakit pa kami merong PE? Nag-PE na kami nung high school. Ito nakalagay siya sa curriculum. Part talaga siya. Kailangan mo uling mag-PE. Yun. Okay? And then we also have the NSTP courses, 6 units. And then, here comes the core courses. Ito yung mga major nyo na kailangan nyo talaga matutunan, di ba? Now, you have the Chem 111, di ba? You have the analytical chemistry. You also have the biochem. You have the anatomy and physiology. You have the PSTM. You have the bioepi and also the HIS or the ICTM. And then it is comprised of 25 units. Okay? So those are the core courses. So, ulitin ko lang ha. Gen Ed, tandaan, 24 units. GE elective, 9 units. Gen Ed mandated, 3 units kasi Rizal lang siya. And then, the PE courses is 8 units. And then, for the NSTP course, 6 units. And for the core courses, they are 25 units. So, nakalagay dito na ang school dapat mag-meet sila sa basic number of units. Hindi siya pwedeng magkulang. Okay? Pero pwede kaming sumobra. Kung napapansin nyo, dito, ang Chem 1 dyan, based sa CHED, okay lang daw kahit 4 units. But in Fatima, ginawa namin siyang 5 units. So, may sobra kami. may pasobra na isang unit. Gano'n din ang Anacare, meron pasobrang isang unit. Gano'n din ang Anaficio, 5 units siya, 'di ba? So, may pasobra na isa. So, hindi kami po puwedeng magkulang. So, kung gagawin naming 3 units 'yan, hindi kami sumusunod sa guidelines ng SHED. Okay? So, gano'n dapat. Dapat sinusunod mo yung guidelines nila. Okay? 'Yon. So, next is the professional courses. So these are the professional courses. So when you say professional courses, these are the subjects or courses that will appear in the board exam. So dito kukuha ng tanong sa board exam. Okay? So kasama si MLSP1 doon, di ba? This one, MLSP1. The Principles of Medical Laboratory Science Practice 1. This is your MLSP 1. So this is all about introduction to medtech, lab safety, and waste management. Pagdating mo naman ng MLSP 2, pag-aaralan mo na per section in the lab kung ano ba yung mga different tests na ginagawa. And then, phlebotomy, yung pag-extract ng blood. So lahat ito gagawin nyo next semester. So next semester, ihanda mo na yung mga kamag-anak mo dyan sa bahay kasi kukunan mo sila ng dugo, 'di ba? Gano'n. Kasi siyempre, right, paano ka matututo na kumuha ng dugo kung hindi ka magpa-practice? So next sem, kukuha ka na ng blood and then ang pinaka-first pasyente mo or first victim ba, 'di ba? First patient mo, yung mga kasama mo sa bahay siyempre, 'di ba? Kasi wala pa wala pang face to face eh. Pero sana we are hoping na sana next sem meron ng face to face para ligtas yung mga kasama mo sa bahay, 'di ba? Yung mga kaklase mo yung tutusukan mo, okay? Yon. So, phlebotomy na tayo ha, next sem. Now, we also have the CPH or Community and Public Health for Med Lab Science. So, sa CPH, tinuturo natin kung paano mag-gather ng data related to health in the community. For example, sa isang barangay, bibilangin mo kung ilan yung diabetic diyan, 'di ba? Kunyari nabilang mo sa isang barangay meron kang 200 na diabetic, right? So, nung nalaman mo na 200 ang diabetic, gagawa ka ng intervention for them. So, pwede kang mag-conduct ng seminar, on how to educate them kung paano ba makontrol yung kanilang diabetes or conduct an exercise program for them, papa-Zumba ka doon and all, yon. And then, after 1 year or after a few months, babalik ka sa community, kukuha ka ulit ng data, 'di ba? Titingnan mo kung ilan na ba out of 200. Let's say out of 200, 150 controlled na ang diabetes nila. So, ibig sabihin noon, effective yung program mo. Yung pa-Zumba mo, tsaka yung pa-seminar mo, nasunod nila, kaya yung kanilang diabetes naging controlled na. Okay? Yun. So, ganun ang ginagawa sa public health or community and public health. So, gagawin nyo na, you're going to gather data sa isang community, then gagawa ka ng intervention, then gather another data again. Okay? Now, for cytogenetics naman, this is all about study of heredity. Ano yung mga namamana mong sakit? So, this is more on clinical. Kunyari, nagkaroon ka ng dwarfism, di ba? Bakit ka nagkaroon ng dwarfism? Ano ba yung characteristic ng dwarfism? Saan ba yung cause ng dwarfism? Another example is Mongolism, 'di ba? Bakit nagkaroon ng Mongolism? Ano ba yung cause ng Mongolism na 'yan? Saan yung problema? So inaalam mo lang yung problem in terms of heredity. Mga sakit ang inaaral dito. And of course, basic concepts regarding DNA and RNA. And then you have human histology. For the human histology, para siyang anaphysio pero tissue level ang inaaral natin. So you're going to take a look at the normal tissues and the function of a normal tissue. Yung normal tissue function and also yung itsura ng kanyang mga tissues. So that is the human histology. Now, for the histopathologic techniques with cytology, you're going to study here the abnormal tissue. So, kanina yung human histology, normal tissues yan. Pagdating naman sa histopath, yung mga abnormal tissues, yung mga may sakit na. Ano ang itsura ng tissue kapag may cancer? Ano ang itsura ng tissue kapag may infection, di ba? Ano ang itsura ng tissue kapag meron kang damage sa tissue, okay? Those are the histopathologic techniques. And then, this also involves the processing of tissues. For example, merong tumor, 'di ba? Yung tumor kinuha sa pasyente, dinala sa yung tumor. Ano gagawin mong processing doon? How are you going to store the tissue, 'di ba? And process it. So, you're going to dehydrate the tissue, you're going to harden the tissue and then soften the tissue, and then you're going to cut the tissue into pieces and then you're going to place it in a microscope and observe it. Okay, ganon ang ginagawa sa histopath. All about tissue processing and observation of abnormal tissues. Now, for the clinical bacteriology, bacteria ang inaaral dito. So, what are the different diseases caused by the bacteria? How does a bacteria can cause a disease? How are you going to identify the bacteria, di ba? How are you going to process the bacteria in the laboratory? And how are you going to identify what antibiotic is effective against that bacteria? Kasi klase sa bacteriology, ganun lang naman yung gagawin mo eh. Pagdating ng specimen, patubuin mo yung bacteria. Kapag tumubo na yung bacteria, i-identify mo siya. Gumawa ka ng mga test to identify the bacteria. And then after identification of the bacteria, you're going to test antibiotics that will actually kill the bacteria. Kasi yun ang kailangan ng doktor. Kailangan malaman ng doktor ano yung bacteria at ano yung antibiotic na kailangan niyang ibigay sa pasyente. And then you are the one who is doing the different tests for that. Okay? Now, for the clinical parasitology naman, this is all about observation of the different parasites coming from the stool of the patient. So, pwede mo makuha doon yung buong bulate. For example, nagtatae yung bata, may bulate sa tiyan. Kapag tumae siya, yung buong bulate lalabas. So, kukunin mo yung bulate na yun, titignan mo, aalamin mo kung ano siya. So, inaaral niya sa parasitology, yung mga bulate. You must be able to identify kung anong bulate ang meron. Or, kung wala man lumabas na bulate, titignan mo yung mga itlog ng bulate sa stool. Kasi minsan yung bulate talaga naiiwan sa tiyan ng pasyente. Minsan naman yung bulate nasa baga, nasa lungs. Minsan yung bulate nasa blood. Kaya hahanapin mo yung kanyang mga itlog para malaman mo kung anong bulate yung meron sa katawan ng pasyente. And then yun ang kailangan ng doktor kasi per bulate may kanya-kanyang gamot yan. Okay? Yun. Now, for the immunohematology and blood banking, this is all about blood transfusion. Ito yung mga test na ginagawa bago magsalin ng dugo sa pasyente. So, in immunohematology and blood bank, you're going to learn how to perform cross-matching, blood typing, antibody testing. Okay? So, yun yung mga inaaral sa blood bank. And also, yung mga different blood type. Ano ba yung mga different blood type ng pasyente? Ano ba yung mga blood component na pwedeng isalin sa pasyente? Paano ba mag-process ng blood bag? Paano mag-collect ng blood bag? Paano mag-process ng blood bag? Ano ba yung mga different blood components na pwedeng isalin sa pasyente? Ano yung mga benefits? 'Di ba? Those are example of immunohematology or blood bank topics. For the mycology and virology naman, this is all about study of fungi and viruses, 'di ba? Yan. So para lang siyang bacteriology pero iba ang inaral, fungi and virus naman. Now, for the lab management, this is all about to give you an idea on how to run a laboratory. Because someday, magiging head din kayo ng laboratory, so kung paano mag-manage. Ganun, madali lang siya actually. For the METIC law and bioethics, this is all about the related laws in medical technology and how you're going to deal with the medical bioethics part. So, tuturuan kayo ano ba yung mga palliative care, ano ba yung mga beneficence, etc. Okay? For the hematology 1 and hematology 2, yung hematology class, this deals with study of the blood. Inaaral niyo yung red cells, white blood cells, platelets, 'di ba? And how to assess them. So, inaaral mo yung red cell count, white cell count, platelet count, and other blood indices that will tell you if the patient has a normal CBC or complete blood count. Pero hindi lang naman CBC ang inaaral sa hematology. Sa hematology 2, inaaral din ang coagulation studies, yung mga blood clotting mechanism ng tao. So sa hema, aaralin niyo yung mga sakit, ano ba yung mga sakit sa dugo, ano yung anemia, ano yung leukemia, 'di ba? And then what are the different tests to perform, to conduct, 'di ba? What are the different tests that you must conduct to identify kung meron bang leukemia or anemia yung pasyente. Besides that, pwede rin ang infection, makikita rin niya sa CBC. Okay, so those are the hematology. For the clinical microscopy naman, this is all about analysis of body fluids except for blood. So, kapag blood kasi, inaaral siya sa hematology and clinical chemistry. Doon papasok ang mga blood. Pero kapag clinical microscopy, aaralin mo dito yung other body fluids mo, such as the urine, di ba? Yung ihi. Ano pa? The CSF, the fluid in your brain. Ang tawag doon ay cerebrospinal fluid. The fluid in your chest, which is the pericardial fluid. The fluid in your lungs, which is the pleural fluid. The fluid in your abdomen, which is the peritoneal fluid. You also have fluid in your joints, the synovial fluid. Ano pa ba? Fluid in your stomach, the gastric juice, 'di ba? Gastric juice. And also your sputum and ano pa ba? I think yun lang, yun lang naman siya. So yun ang mga inaaral sa clinical microscopy, yung mga other body fluids except for blood. Okay? So, sa clinical microscopy, meron diyang, of course, microscopic examination. Ano bang itsura ng mga cells ng mga fluids na yan? Besides the cells, besides the microscopic examination, meron ka rin mga chemistry test, 'di ba? Tinitest mo rin siya for different analytes. Now, for the clinical chemistry 1 and clinical chemistry 2, this is all about analysis of the different analytes in your blood. So, ano ba example ng analytes? Example, yung electrolytes mo, yung sodium, potassium, chloride, ano pa, yung glucose, 'di ba? Yung mga liver enzymes mo, yung mga BUN mo, creatinine sa kidneys, 'di ba? Tapos ano pa, yung glucose mo, yung lipid profile mo, yung cholesterol, yung HDL, LDL, yan ang inaaral sa clinical chemistry. So kapag clinical chemistry 1, you're going to learn about quality control in the laboratory on how to perform the following test. Yung mga sinabi ko kanina, di ba? And then also, meron ka rin dito ng mga computation. So, meron din siyang lab mathematics. Kasi nga, di ba, sa analytical chem nyo, meron kang computation doon. Pagdating naman ng clinical chemistry, computation again, pero in relation to the clinical laboratory na. Okay, so gano'n pa rin meron tayong math ha, wag niyong isipin na walang math ang medtech, meron. Gagawa ka pa nga ng mga graph dito, eh, sa clinical chemistry 1, okay? And then after that, aaralin niyo na yung glucose, 'di ba, yung mga sugars, yung lipids, yung mga fats, yung mga cholesterol, aralin niyo 'yan. And also pati yung mga kidney function, yung sa bato, 'di ba? And also yung sa liver mo, aaralin mo 'yan. Pagdating ng clinical chemistry 2 naman, this is all about kasama rin dito ang liver in terms of therapeutic drug monitoring. Kasi you have to monitor yung mga pasyente na umiinom ng mga gamot kung nagkakaroon na ba ng toxic effects yun sa kanilang dugo or sa kanilang katawan. Okay? So kasama yun sa clinical chemistry 2. Sa CC2 rin, you're going to study about hormones, ano yung mga effect ng hormones sa katawan, and also yung mga toxins. So meron din dito na toxicology, 'di ba? Yung mga lason, yung mga poisons, aaralin niyo rin. And also yung mga tumor markers kasama rin diyan for cancer diagnosis sa clinical chemistry. And also drug testing, yan. Kasama rin class ang drug testing sa clinical chemistry 2. Now, for the mol bio and diagnostics naman class, so magkaiba 'to sa cytogenetics. Sa cytogenetics kasi, you're going to deal with the diseases related with heredity. Pagdating naman sa molecular biology and diagnostics, you're going to deal with the DNA and RNA itself. So, aaralin niyo kung paano ba mag-PCR, okay? Paano ba mag-test ng DNA? Ano ba yung mga DNA na yan? Ano ba yung genes na yan? So, hihimay-himayin niyo in a deeper level, what is a DNA? Okay, ganun siya. For the seminar 1 and 2, together with the MTAP, ito yung mga courses nyo or subjects sa 4th year level. So, for the seminar 1 and 2, this is a discussion course wherein lahat ng inaral nyo sa 3rd year, tulad niyan, HIMA 1, clinical chemistry, i-discuss uli ng prof nyo dito sa seminar. Parang review course siya. And then pagdating sa MTAP is the assessment. So, yung mga inaral nyo sa 3rd year na HIMA, na clinical chemistry, lalabas uli siya sa MTAP. Okay? So, puro exam lang yung MTAP na yan. Papasok ka, bibigyan ka ng exam ng prof mo about hematology or chemistry or kung ano man yung topic nyo for that week. Okay? So, these are the professional courses. So, it is made up of 65 units for the professional courses. Again, 65 units for professional courses. Now, next is the research courses. Now, for the research course, pero kang dalawa. You have the research 1 and also the research 2. For the research 1, this is all about introduction on how to write a research paper. For the research 2, this is all about presentation and experimentation. So gagawa kayo ng experimental research. Dito na kayo mag-i-experiment. Sa research 1, nagpaplano pa lang kayo, gumagawa kayo ng mga concept, kung ano ba yung thesis na gagawin nyo. Pagdating ng research 2, gagawin nyo na yung thesis nyo. Mag-i-experiment na kayo here. Okay? So those are the research courses. Now, for the research courses, it is 5 units. Now, after that, after the research will be the internship. So, for the internship courses, you have internship 1, ito yung first rotation nyo. Internship 2, this is your second rotation. And then you also have the MTAP 1 and the MTAP 2. So, you have 28 units for the internship courses. Okay? So, 28 units siya. Now, summary of units. So for the Gen Ed, you have 24. For the elective, you have 9. For the mandated, you have 3. For the PE, you have 8. For NSTP, you have 6. For the core, you have 25. For professional, you have 65. For research, you have 5. And for the internship, you have 28. A total of 173 units. Again, take note, you're going to learn 173 units. Ito ang required natin. Now, for the clinical internship program naman, there is a required number of contact hours. Ibig sabihin noon, required number of duty hours yung sa ospital. So, kailangan nyo talaga mag-duty sa ospital. Okay? So, per year ito sa isang taon ang bilang nito. So, sa clinical chemistry daw, kailangan mag-duty ka ng 300 hours. For the microscopy, 200 hours. For microbio, 250 hours. For hematology, 300 hours. For blood bank, 200 hours. For histopath, 100 hours. For immunosero, 220 hours. For labman, 40 hours. And for phlebotomy, 54 hours. So, ito yung mga required number of hours na dapat mag-duty ka sa ospital. A total of 1,664 hours in 1 year. Isang taon na to class total na yan. Okay? Now, so paano ba dapat ang duty nyo? For example, sa isang linggo, meron kang 8 hours duty. Ibig sabihin ng duty ka ng 8 to 5, 8 a.m. to 5 p.m. Okay? Dalawa daw sa isang linggo. Kunyari, Monday and Tuesday, 8 hours ang duty mo. So that is 16 hours na. Plus, 1 16-hour duty per week. So, Monday, Tuesday, 8 to 5 ka lang. Pagdating ng Wednesday, night duty ka na. So, ang pasok mo, 10 p.m. hanggang 6, ang pasok mo ay 7 p.m. hanggang 7 a.m., 'di ba? So, 16 hours duty na siya. Okay? So, meron kang 2 day duty tsaka isang night duty. So, sa isang linggo, meron kang 32 hours na total. So, you're going to multiply that by 52 weeks kasi sa isang taon, required ka mag-duty ng 52 weeks. So, a total of 1,664 hours. Okay? So, ganun daw dapat ang duty mo. 2 day duty tsaka isang night duty. So, tapos, meron ka pang 2 off dapat. Isang regular off. So, kunwari, Monday, duty ka, 8 to 5. Tuesday, ganun din, 8 hours duty. Pagdating ng Wednesday, meron kang night duty. So, pagdating ng Thursday, day off mo na yon kasi galing ka ng night duty, matutulog ka. And then, pagdating mo ng Friday, internship, pagdating mo ng Friday, papasok ka sa school kasi meron ka pang seminar and MTAP. Okay? So, ganun siya. So, duty ka ng Monday, Tuesday, night duty ka ng Wednesday, day off ka ng Thursday, and then pagdating ng Friday, punta ka sa eskwelahan kasi meron kang CPAP. Okay? Meron kang MTAP and seminar. So, nakalagay dito, the intern shall be allowed 1 day off per week and 1 more day for medical technology assessment program and seminar in their respective HEI. So, papasok ka pa rin sa school. Okay? So, no MT or MLS student shall be allowed to graduate unless he or she has completed all of the academic and internship requirements. So, kailangan talaga makumpleto mo yung number of hours of duty. And then, isa pa, bawal ang 24 hours of duty. So, dati kasi, pwede mag 24 hours. Pwede yon nung panahon ko na nag-aral ako, duty kami 24 hours. So, kung Monday, Tuesday, naka-duty kami, pagdating ng Wednesday, duty kami ng 24 hours hanggang Thursday. Tapos, puyat-puyat pa kami, wala pa kami sa sarili, papasok na kami sa school ng Friday para mag seminar and MTAP. Okay? So, gano'n kami dati. Pero kayo, masuwerte kayo kasi bawal na ang 24 hours duty. So, meron kayong pahinga. Yung Thursday niyo, day off niyo 'yun, matutulog kayo tapos mag-aaral kayo, 'di ba? Kasi pagdating ng Friday niyo, may pasok kayo sa school, okay? So, gano'n gano'n kayo kasuwerte, maluwag sa inyo. So, pagdating naman sa eskuwelahan naman, meron tayong required number of contact hours. So, sa laboratory class ito, Now for the ICTM, 50 to 54 hours 'yan. For the Chem, 108, gano'n ang CPH, Analytical Chem and Biochem. Ibig sabihin class, ito yung number of laboratory hours nyo dapat, okay? For the Bio-Epi and Histo, 54 hours. For Mol Bio, ANAFI, and also CC1, 108 hours. For MLSP2, 54. For BACT, 108. For Para, 54. So, maraming hours talaga dapat ang laboratory nyo. So, mandated siya sa CHED na dapat meron kayong contact hours in the laboratory. Kaya nga naman, meron tayong face-to-face. Okay? So, sa November, yung mga fourth year natin, papasok na sila, mag-face-to-face na sila because we have to comply with the number of contact hours sa laboratory. Okay? Required siya para makagraduate kayo. So, kayo rin, magkakaroon din kayo ng face-to-face classes sa laboratory. Okay? Pero hindi pa ngayon, sa susunod pa kayo. For the hematology, ito siya. Ito yung mga number of hours niya. So, ilan yung total number of hours ng laboratory? Dapat makarender ka ng 1,728 hours in the laboratory. Ito yung required na contact hours sa laboratory classes. 1,728 hours. Okay? So, after completing all of the requirements sa eskwelahan, gagraduate ka na. Anong next step mo? You have to take the board exam. So, ang board exam, nanggagaling yan sa PRC. Yung PRC, that is the government agency that will administer the exam. So, ang responsibility nila, mag-administer ng exam. Now, sino naman si PRB? Si PRB, that is the board or the Professional Regulatory Board for Medical Technology. Ito yung mga tao na gumagawa ng tanong sa board exam. So, ilan sila? Tatlo sila class. You have a pathologist plus 2 RMT in the hospital. So, meron kang isang pathologist tsaka dalawang medtech coming from the industry or coming from the hospital. Ngayon, yung mga tatlong tao na yan, hindi sila dapat affiliated with any schools in the Philippines. So, hindi sila nagtuturo, hindi sila mga prof. Talagang taga-industry sila, taga-industriya. Okay? So, sila yung gumagawa ng tanong for the board exam. Saan nila kinukuha yung mga question? Sa CHED. Sa CHED Technical Committee, nanggagaling yung kanilang basis. That is why, kung ano yung binigay ng CHED Technical Committee, kailangan namin siyang ituro. Okay? So, yung board exam natin, it happens 2 times a year. Meron kang every March and August. And then, these are the different percentage or breakdown of the licensure exam. So, you have 20% for clinical chem, micropara, and hematology, blood bank immunology, and 10% for microscopy and histopath. Okay? So, those are the breakdown of the exam. So, para pumasa ka, anong dapat gawin? Dapat, ang GWA mo is 75%. And then, no rating below 50% sa mga courses. For example, naka 75% ka ng GWA, pero yung hematology mo, 45% lang ang score mo. Papasa ka ba? Hindi, bagsak ka. Kasi sabi dito, no rating below 50%. Okay? So kung 75% yung GWA mo, pero 45 lang yung hematology mo, failed ka. Kailangan mong umulit ng exam. And then, pass in at least 60% of the courses, computed according to the relative weights. So, to have a license, kailangan you must be 21 years old. That is the required age to practice medical technology in the Philippines. Kung hindi ka pa 21 years old, magkakaroon ka ng certificate of being a medical technologist, nakapasa ka na ng board exam, pero you will not be given a license to practice kasi nga, underage ka pa. Okay? So, hindi ka pa pwede mag-practice sa Philippines. Pero pasado ka na, 'di ba? And then, paano kung bagsak ka? Kapag 3 times ka nang bumagsak sa board exam, kailangan mo uling mag-aral. You must be able to enroll in a refresher course. So class, ito yung reason kung bakit yung mga prof nyo mahigpit sa inyo during exams. So, Kami naghigpit kami, ayaw talaga namin ng nandadaya kayo, okey? Kasi ganito 'yang class, madali lang mandaya sa online class. Napakadali 'di ba? I think you will agree. Sa mga quizzes niyo, sa mga major exam niyo, madali mandaya, napakadali kasi online, 'di ba? Pero pagdating kasi ng board exam class, hindi siya online, face to face siya. So wala kang paraan para mandaya sa board exam kasi yung katabi mo 5 seats apart kayo, 'di ba? Sa isang classroom nga 6 lang kayo, gano'n gano'n kaluwag, gano'n kahaba, 'di ba? So paano ka kokopya, saan ka kokopya do'n, 'di ba? Another thing is pagdating mo sa ospital, kapag medtech ka na at meron kang 8 pasyente sa harapan mo, lahat yung 8 yun dumudugo o naghihingalo. Anong gagawin mo, may kokopyahan ka ba? Wala kang kokopyahan, 'di ba? Wala. There is no way to cheat out of that. So, if you're going to cheat, isipin niyo na lang na yung parents niyo lugi sila kasi after you graduate, you will not be able to pass the board exam. Para saan pa na nagtrabaho yung parents mo, nagbayad sila ng tuition fee, ang hirap-hirap ng pera ngayon, 'di ba? May pandemic, yung mga parents niyo, yung iba diyan nangutang lang na pang tuition fee niyo. So, yung investment nila sa inyo sayang kapag hindi ka pumasa ng board exam. Kasi tingnan niyo, kapag bumagsak ka daw, kailangan mo uling mag-aral, babalik ka sa eskuwelahan, 'di ba? So, bakit bakit doon ka pa mag-aaral, ba't 'di ka na lang mag-aral ngayon, right? Kaya nga sabi ko sa kanila, sa mga third year namin, sa inyo rin sinasabi ko na mag-aral kayo ngayon na. Kasi investment niyo 'yan. Dahil pagdating niyo ng licensure exam, papasa kayo, magkakaroon kayo ng lisensya, makakapagtrabaho kayo. Pero kung ang gagawin niyo lang puro cheating lang sa exam kasi online class lang naman, madali mag-cheat talaga kapag online, madali. Kung puro cheating kayo, naka-graduate kayo dahil sa pandaraya, pagdating niyo ng board exam, you will not pass. At babalik pa rin kayo sa eskuwelahan, mag-aaral kayo ulit, 'di ba? So, kawawa yung binayad ng parents niyo, yung mga pinang-utang ng magulang niyo hindi niya mababayaran kasi hindi kayo makakapagtrabaho, 'di ba? Oh, so ang pinakatalo dito talaga yung magulang niyo. So, kung sa tingin niyo everytime you're cheating na, "Ay naisahan ko si ma'am, naisahan ko si ma'am." Hindi niyo kami naisahan, tandaan niyo yung class, hindi niyo kami naisahan. Kasi kami license na kami, may trabaho na kami. Ang naiisahan niyo yung magulang niyo, kawawa naman yung magulang niyo, 'di ba? Yung pinang-utang niyang tuition fee, yung pinagtrabahuhan ng magulang niyo, kawawa. Kaya whenever you are cheating sa exams, you are cheating your parents. Okay, 'yun ang tandaan niyo. Not us, may trabaho kami, may suweldo kami, 'di ba? Hindi niyo kami dinadaya. Okey, yung parents niyo ang dinadaya niyo. Kaya sana maawa kayo sa magulang niyo, huwag kayong mag-cheat. Kasi tingnan niyo, if you fail 3 times sa board exam, if you failed, you're going to go back to school. And then tingnan niyo kapag ang GWA mo 74 lang to 70, anong trabaho mo? Lab tech, magkano ang suweldo niyan ng lab tech? Ang lab tech class 4,000 lang ang suweldo niyan. Technician, below minimum 'yan class. Paano kayo anong maitutulong niyan sa magulang mo? Wala, 'di ba? So, 'yan ang mangyayari sa'yo kapag di ka nag-aral ng mabuti. So, make sure na mag-aral ka ng mabuti kasi ito yung lalabas sa exam. This is the breakdown. And then dapat makuha mong grade at least 75%, okay? So, I hope ngayon palang first year kayo, alam niyo na kung ano yung mga dapat gawin, okay? Now, we also have the program goals and learning outcomes. So, when you say program goals or learning outcomes, ito yung mga expected namin na makita after you graduate as a course of the medical technology. So, pagka-graduate nyo dapat daw, you must be able to demonstrate knowledge and technical skills. So, alam mo at marunong kang gumawa ng mga test sa laboratory. Dapat meron kang professional attitude and professional values. So, ibig sabihin noon, magalang ka sa mga staff, marunong kang pumasok sa tamang oras, 'di ba? And you are professional sa mga pasyente, okay? And then, marunong ka ng critical thinking and problem solving skills, which is actually a very, very important skill kapag medtech ka. Kailangan talaga mabilis ang utak mo kapag medtech. Kasi, for example, um, nagkaroon ng vehicular accident. This is based on my experience nung nagtatrabaho ako sa ospital. Nagkaroon ng vehicular accident, yung UV Express nabangga siya ng isang truck. So, 8 tao, sabay-sabay dinala sa ospital namin na nagtatrabaho ako. Yung 8 tao na yun, dumudugo sila, bali-bali ang mga buto. Yung 8 tao na yun, naghihingalo. They are fighting for their life. Okay? So, Pagbaba ko sa ER, yun ang lumabas, yun ang una kong nakita, hala 8 sila, mamamatay na ata 'tong 8 taong 'to, gano'n. So, anong gagawin mo, 'di ba? Sinong uunahin mo sa kanila? So, dapat meron kang critical thinking and problem solving skills. Dapat alam mo on the spot kung sino yung uunahin mo. Ikaw magde-decide nun, eh, 'di ba? At lahat yun natututunan mo in our schooling, sa pag-aaral natin. And then kuha ako ng sample sa kanila, pag-akyat ko sa taas, problem naman, sinong uunahin ko sa mga yon sa processing ng specimen nila? So, dapat meron ka ring way on how to decide on sinong uunahin sa kanila. Lahat 'yun natututunan mo sa school. Kasi here in school, tinuturo natin kung paano mag-prioritize ng patient and specimen, okay? So, lahat 'yan alam mo, sa eskuwelahan 'yan natutunan. So, importante 'yun, kasi paano kung ano, hindi ka nag-aral sa school, tapos 'yun ang humarap sa'yo, 8 pasyente na mamamatay na. Anong gagawin mo, 'di ba? Oh, kaya kailangan mo talaga mag-aral ng mabuti, okay? So again, participate in self-directed lifelong learning activities. Ibig sabihin niyan, you will also attend trainings and seminars even after you graduate kasi nga there are many new technology pagdating sa medical field, 'di ba? Bagong machine, bagong instrument, kailangang aralin niyo kung paano siya gamitin. And of course, participate in research and community service, have leadership skills, and demonstrate collaboration, teamwork, integrity, and respect. So all of these are expected to be seen to our students after they graduate. Okay? So also, we have assessment. So for the assessment class, ito yung mga test na ginagawa namin sa inyo. So, kailangan talaga na magbigay ng assessment. It is part of the curriculum. Okay? So when you say assessment, it must be planned, systematic, and organized way of testing, measuring, collecting, and obtaining necessary information to gain feedback on student progress. So this is our way to know kung meron bang natutunan yung estudyante. And then, I am very happy kasi nga naman, itong ano nyo, prelim nyo, ang taas ng mga scores niyo sa prelim and then most of you pasado. So, yung grade niyo sa prelim is pasado, karamihan sa inyo, 'di ba? So, ibig sabihin noon, meron kayong natutunan during the prelim term, okay? So, okay siya. So, that's why gumawa tayo ng assessment. Meron tayong mga quizzes, meron din tayong mga major exam. So, hindi lang naman exams pagdating sa assessment. Pagdating sa assessment class, kasama din doon ang assessment of psychomotor skills. Kaya nga naman, meron kang mga laboratory classes. Sa laboratory class, pagdating ng face-to-face, meron doong practical exam. Kunwari, sa harapan ko, kukuha ka ng dugo sa harapan ko. Or sa harapan ko, ipaprocess mo yung bacteria. Sa harapan ko, ipaprocess mo yung urine, di ba? That is what you call the psychomotor skills. And then we're also going to assess that kung tama ba yung pag-process mo sa urine, sa bacteria, and also sa blood. Okay? Kasama yan sa assessment ng psychomotor skills. Now, ano mga different types of assessment? You have the formative, summative, and diagnostic. Ang diagnostic class, this is given prior to instruction. Ibig sabihin noon, pagpasok pa lang ni teacher, meron na siyang exam. Wala pa siyang ginagawang discussion, wala pa siyang sinasabi, 'di ba? Wala pang nasisimulan. Kasi pagpasok niya sa pintuan, "Okay class, get 1/4." So magku-quiz na kayo, okay? That is diagnostic. Ginagawa 'yan class pagdating sa third year. It is a normal practice na meron kaming tinatawag na pre-test and post-test. Yung pre-test na 'yon, pagpasok ni prof, papa-quiz na siya. Kasi pagdating ng third year class, you are all required to read the textbook before coming to class. Bakit? Kasi marami kayong aaralin. Okay? So that is why meron kayo laging diagnostic exam or pre-test. And then after the pre-test, the prof will now discuss. Magdi-discuss na siya, 'di ba? And then after the discussion, magbibigay na siya ng doon na papasok yung formative, okay? Magbibigay na siya ng post-quiz. So for the formative, this is assessment of learning, quizzes, short answer question, and reflection paper. Okay? So mapapa-quiz na siya after niya magpa-discuss. And then, by the end of the term, meron siyang summative exam. Yung summative, ito yung prelim exam mo, midterm exam, and final exam. Ito yung maramihan na tanong. Okay? Maramihang exam yan. So, pwede rin class na comprehensive exam, research term paper, final project, or unit exam. Okay? So, ito yung mga tatlong exam na you're going to encounter pagdating nyo ng third year. Meron siyang diagnostic, meron kang formative pagkatapos ng discussion, and meron kang summative every end of the term. Okay? Those are the different types of assessment. Now, for the assessment tools, ito yung mga different tests na pwede namin gawin. So, we're going to make written test, di ba? Yung mga major exam nyo. That is example of a written test. Reflection papers to enhance your writing skills, pwede rin. Portfolio, when you say portfolio, this is a collection of your output. Kunwari, yung mga quizzes mo ng prelim, quizzes ng midterm, quizzes ng finals, yan ay example of a portfolio. Okay? Now, for the performance task, these are the written demonstration or practical exam. Na sa laboratory, you're going to demonstrate how to collect blood, how to process the urine, how to process the bacteria, etc. Okay? For the oral examination naman and presentation, this is to improve your communication skills. So for example, you will be asked to explain. Kumbaga, tatayo kayo sa harapan ng klase. Then you're going to explain what is a bacteria, explain what is a virus, 'di ba? Those are example of oral communication. Why? Kasi why do we do that? Because when you talk about it, you remember it. Ito yung ginagawa namin sa laboratory. During the time that you are performing the laboratory test, you're actually explaining it to us. So for example, sa urinalysis, sasabihin mo na first, I'm going to mix the urine. Why? Because this is needed for to have an equal distribution of the cells, 'di ba? So habang minimix mo siya sa harapan ko, ini-explain mo kung ba't mo siya ginagawa. So gano'n ang mga performance tasks and oral examination namin sa laboratory. Ginagawa siya kasi kapag sinasabi mo daw, mas naaalala mo. Okay, so that's how we assess. And then of course, for the rubrics, this is the technical scale or criteria on how we are going to grade you. So meron doon na mga chine-check kami na boxes na kapag nagawa mo yung task, may check ka doon, ito yung points mo. There is an example of a rubric. Okay? Now, next is the job opportunities. So marami kang pwedeng maging trabaho. You can work in the hospital or the freestanding lab. You can also become a scientist, a member of the academe, a perfusionist, a molecular scientist, a product diagnostic specialist, public health practitioner, or healthcare leader. Yon. So that is the topic for this week. So do you have any questions, class, about the topic? Do you have any questions? Anyone?